What is the demand for the opioid addiction treatment resources that you provide here?
They are extremely high. We see approximately 20 new patients per week with either withdrawal symptoms or opioid use disorder desiring to start medication-assisted treatment. The problem has been ballooning in the state of Pennsylvania overall, as there has been a 30% increase in overdose death rates in the past year, which is astonishing and alarming, and we all need to do what we can to try to get patients into treatment quickly.
What are the main things that people come here for?
They come here to either start methadone maintenance, Suboxone maintenance, or Suboxone by prescription, and I should say buprenorphine, naloxone, instead of the brand name, because there's several different formulations, and also extended release naltrexone, which is the Vivitrol injection. Hopefully they will be coming soon for the buprenorphine injection formulations that have been recently released on the market. They also come here for counseling. We have intensive outpatient counseling services and outpatient counseling services, and we will soon be able to offer primary care services for these patients. So anybody lacking medical treatment at the same time will begin to offer that for them.
Talk about, in terms of treating opioid addiction, talk about the importance, impact of having medication-assisted treatment.
Medications such as methadone and buprenorphine have been shown to keep people engaged in treatment for much, much longer than if they were not to receive any medication at all. The current statistics show that if you engage in methadone maintenance and counseling at the same time, the rate of continued engagement at 6 months is 7 in 10. So 7 people out of 10 are going to still be engaged in treatment at 6 months. This is as opposed to counseling alone, which is 1 in 10 over the same time period. The rate of treatment engagement for buprenorphine at 6 months is about 5 to 6 in 10. And for extended release naltrexone or Vivitrol, the rates are still currently being investigated, but right now they look at a 1 to 3 in 10 treatment retention rate. We still need information on the injectable buprenorphine in terms of treatment retention, but we're hopeful that that can really fill in some of the gaps.
What are your views regarding the chances of success for somebody who wants to break free of opioids and they try to do it just on willpower or counseling alone with no period of medication? What are your thoughts now, based on what you've seen, of what their chances are of succeeding through that approach?
I think that a person is not a statistic, and that each person has their own individual story and can create their own destiny. And I think that there are some people who will have a lot of success in doing nothing. In other words, no medication and counseling alone. Not saying that counseling alone is nothing, but counseling alone, it takes an awful lot of effort, and certainly to come off of opioids is very, very difficult. But I hesitate to recommend that form because time and time again there has been overwhelming evidence of treatment failure and relapse when patients try to do this on their own. If I had a family member, really the sun would not set until they're on some form of medication. I also worry that that person might have internalized stigma towards the treatment of addiction. There's really no other disease process where both the illness itself and the treatment for it have equal stigma. And for people who think, wow, this makes me less of a person, this makes me less moral, that I need a crutch somehow, that I'm trading in one addiction for another. If people are out there saying that to themselves, they don't have enough information on the medication, which can be life-saving.
It seems, as we've been really taking this opioid addiction crisis head on for the last few years now, It seems like early on there was widespread use of the approach that's the long-running approach to use to treat alcohol addiction. Is there much of a difference between, say, alcohol addiction and opioid addiction?
There is. There's a big difference. I think a lot of people, certainly in the treatment community, have extrapolated what has worked for them with one use disorder onto another use disorder. In other words, what worked for me in my alcoholism will work for you with your opioid use disorder. I didn't require medications, and therefore you don't need them either. And for those folks, I would say that the two illnesses are quite different. And there is remarkable success rate in people who don't need medication for alcohol use disorder, and those success rates have not borne out with people who have opioid use disorder.